Welcome to the regular update for pregnant women and their families in Australia and New Zealand during the global coronavirus pandemic. This week, the state of Victoria has gone into a stage 4 lockdown for the purpose of controlling the outbreak of coronavirus. It is scheduled to be for a 6-week period. Meanwhile, all our other states and territories and New Zealand have varying degrees of social restriction, ranging from no restrictions through to partial restrictions, but all potentially subject to change at short notice if the situation were to change. In the previous updates, I have talked about the effects of COVID-19 infection in pregnancy. We now have an additional issue to address: the effect of lockdown. We do not really know how this intervention affects people, both for people generally and in particular the impact on pregnant women and their unborn babies. One thing we do know for certain, and that is there are potential effects on mental health, both for people with pre-existing mental health issues and also people for whom the first time may be experiencing problems. Caring for your mental health during this pandemic and lockdown has been addressed very effectively by the president of our college, Dr. Vijay Roach, and I recommend to you the video presentations he has made on this topic. They are informative and very helpful. You will find links to these videos at the end of this presentation. But the effect of the lockdown on pregnancy has recently become very interesting. There is good news and some potential not so good news. First, the good news. There are reports from at least 3 places suggesting that lockdowns may be preventing early preterm birth: Denmark, Ireland, and Canada. All 3 experiences are yet to be formally published and are not yet cleared by peer review, so there is a big note of caution. But the issue is so important at this time that we may need to consider what may be happening. The study from Denmark was a whole-of-population review of all births in their country during the lockdown in March and April of this year, compared with previous years. There was a 90% reduction in extremely preterm births, that is, births up to 28 weeks gestation. Preterm births after that time were not altered. In Ireland, a review of pregnancy outcomes from several of their counties showed a 73% reduction in early, very low birth weight infants, reflecting a similar reduction in early preterm births. There have also been reports in the general lay media of a reduction in early preterm births in Calgary, in Canada. So what could be causing lockdowns to have such a dramatic effect on preventing early preterm birth? First, it is important to emphasise again that these reports have yet to be published in peer-reviewed scientific journals, so there remains a degree of uncertainty. Possible causes could include beneficial effects of avoidance of workplace stress and the travel required to get to the workplace, perhaps less exposure to other infections due to social distancing and being at home, perhaps benefits from the comforts of home and family life, perhaps reductions in illicit substance use and smoking, and possible beneficial effects from maternal vaccinations, which we know can stimulate the immune system generally. Now for the not so good news. There have been reports of an increased rate of stillbirth in London in the United Kingdom during their lockdown. This increased rate was not due to COVID-19 infection itself, but rather was thought to result from reluctance of women to go to hospitals that may have had cases of the infection. And an increased risk of stillbirth is not the only bad outcome that people in lockdown can experience. There have been reports of people not accessing healthcare for cancer diagnosis and treatment as well. We want to make it very clear that the lockdown should not stop you from accessing the health care that you need. The medical systems in Australia and New Zealand are well equipped to look after you. If you are concerned about yourself or your baby's movements, please call your midwife or doctor. So, at this moment in history, we have some very important research to do on the potential benefits of lockdown and the potential dangers. Australia is ideally placed to provide great information in this area. We have 8 states and territories, each with their own different rates of COVID-19 infection and lockdowns. And in some regions, we also have the confounding effects of previous drought and bushfire. The Australian Preterm Birth Prevention Alliance, which co-hosts these updates, is ideally placed to lead an Australia-wide study of the effects of lockdown on pregnant women. The Alliance includes leading specialists across all our regions and all our relevant disciplines. We now have commenced the process of seeking approvals to access the data needed to answer these very important questions. I look forward to us being able to provide you with updates on the Australian outcomes of lockdown on pregnancy as rapidly as possible. In the meantime, no matter where you may be, take care. Follow the instructions you are receiving from your local authorities. Maintain your social distances, wash your hands frequently, and be kind to yourself and everyone around you. If you are in lockdown, make sure you receive health care that you need. We will get to the other side of this pandemic, but together we have much more work left to be done. That ends this update. I'll be back in a few weeks to provide any new information on the pandemic and what it means for pregnant women and their families. Until then, stay well. Thank you.